I'm presenting the poster on intermediate care, which is something we've been involved in as a practice for a number of years now, particularly over the last 2 years where I've been responsible for it. We've had quite an expansion of it. So it's gone from covering about 45 patients to just over 100, and there's quite a big turnover. We have at the moment 4 hubs, 3 of which are council-run, sort of 30-bed intermediate care units. So patients come from hospitals, generally elderly over 65. They're not quite fit enough to go home, so they need physio, occupational therapy, and we provide sort of the general practice input because these patients might come from all over the city and be miles away from their own GP. So while they're there, we look after them from a primary care point of view. And basically the aim of what we're trying to do is make sure they're getting the best care possible, optimising their medications, optimising their care, to get them home in as well a state as they can be and liaising with the GPs on discharge. Previously we were having GPs supported by our normal receptionists when we had a small unit. When we've got bigger, we thought that's not going to work. So we've brought in prescribing clerks, 9 to 5, 5 days a week, who administrate admin and prescriptions. And we've got practice pharmacists anyway, but we've extended their role. So they're doing medication reviews for us, which is better quality. We've looked at a number of outcomes sort of in an audit, which we did throughout last year. Things like sort of pharmacy or pharmacist-led medication reviews, which is a higher quality than what we do, to be honest, have jumped up from about 35% to 96% within the space of just 6 months because we've enabled that capacity. Medications being transmitted to the surgery, we now monitor and audit, and that's being done in over 90% of cases in a way we can record at either end. And GP reviews and things like admin tasks like letters, we can also audit and say this is being done nearly 100% of the time, which is good.